Cats can suffer from different skin problems, and two of the most common are atopic dermatitis and secondary infections. Atopic dermatitis happens when a cat's skin reacts too strongly to things like dust, pollen, or mold. This leads to intense itching, redness, and sometimes hair loss. In contrast, secondary infections are usually caused by bacteria or fungi getting into weak or damaged skin. These infections can make the skin ooze, smell bad, or form scabs. It is important to know which condition your cat has because each one needs a different treatment. Atopic dermatitis often requires medication to stop itching and inflammation. But if your cat has a bacterial or fungal infection, antibiotics or antifungal drugs are more important. Using only itch relief medications for an infection can make the problem worse. On the other hand, using the same antibiotics for too long can lead to drug-resistant germs. If you suspect your cat has a skin problem, work closely with your vet. Ask about keeping a few different medications at home, so you can switch treatments when necessary. Paying attention to changes in your cat's skin, such as redness, hair loss, or sores, will help you decide which treatment is best. This way, you can help your cat recover faster and avoid bigger problems later on.